As providers, we often don't know all of the regulations as far as the requirements for documenting and submitting. All of that other stuff is really daunting. So after MIPS services through WRS came on board and started directing me and helping me and educating me, first of all, I overcame just the feeling of helplessness. It definitely was wonderful to score 100% because that's a good feeling, but it was even more wonderful to know that these implementations have improved patient care and safety.
I am thrilled to introduce Sheresa Catoe from Carolina Behavioral Healthcare LLC. Cherie has been partnering with WRS Health for 7 years, and we are excited to learn more about your journey and the impact WRS Health has had on your practice. Thank you so much for joining us. Now, Cherie, before partnering with WRS Health, your practice faced notable challenges, particularly with understanding the MIPS program, things like measure, selection, scoring, and submission. What specific challenges did MIPS services help you overcome in managing MIPS compliance?
As providers, we often don't know all of the regulations as far as the requirements for documenting and submitting. For us to be able to meet those qualifications and requirements that were put in place as safety measures, quality measures, all of that stuff. We're focused on patient care, and that's our primary focus, and all of that other stuff is really daunting at times. And so before I had WRS MIPS services, I had no idea where even to start. And in a prior practice, I was actually even penalized because I didn't meet all of those qualifications. So after MIPS services through WRS came on board and started directing me and helping me and educating me, first of all, I overcame just the feeling of helplessness. I felt powerless because I didn't understand the whole MIPS PQRS system and the purpose. I mean, I didn't even fully understand the rationale and reasons behind it. So number one, I was just educated, brought up to speed on the purposes of it and how we can go about accomplishment. And then, of course, through the process of learning, every year I learn more. And through this process, I've learned more quality. I can say that I feel like we're providing a more quality service, but also I've learned about internet safety, and I've learned about other reporting systems out there that also improve safety and patient care that I was even unaware of. So overall, I think just having so much more education and feeling empowered to take even better care of my patients.
Well, I'm glad to hear about that you are learning more and more each year with partnering with MIPS services in WRS Health. Now, before I proceed to the next question, Cherie, I'm curious, when you first considered using WRS Health MIPS services, were there any hesitations or concerns you had?
I initially didn't even understand the importance of MIPS and what it was designed for. I didn't understand the importance of even having a consultant to help, and other people in my field had started talking about it and saying, yes, we've hired these contractors to come in and provide these services. And so the cost of that was daunting.
Yeah, I understand those hesitations and concerns, Cherie. Now let's move forward to the next question. What are the specific improvements and results you've had since partnering with us? And how did it alleviate those hesitations or concerns that you had before?
Some of the specific improvements have been through documentation. We often, as providers, get bogged down just trying to keep up to date on documenting what we're actually putting into practice and doing. And we may not document effectively. I think a lot of us don't. Through MIPS, I've learned to be a better documenter, and I've learned how to capture that important data, not only for MIPS, but also that I can go back and review, am I doing these things that improve quality of care? I think as a provider, that's the most important thing to me, is I'm always just seeking to provide the best quality of care I can, and that's where my focus and my hope and relief through the MIPS services comes from. And I know there's importance for the the cost and quality measures and the other internet safety and all of those measures. I know those are important, but for me personally, I really want to just know and feel good that I'm providing quality care.
I agree. Well, thank you so much for sharing that. Since implementing these solutions, like learning how to really document, your MIPS performance score has improved significantly. That's from 83% in April 2021 to a final MIPS score of 100% by December 2023. That's an outstanding transformation. Now, how has this improvement impacted your practice beyond just avoiding penalties?
Again, I think it's about the quality of patient care. There, through the education that WRS MIPS services has provided me on MIPS and the quality measures and the other measures, it made me more aware of what I was doing day to day and what I was missing. And so I have implemented those changes. For example, fall risks assessments. That was something that I inherently was doing, but I wasn't documenting it until the MIPS services came along. That was one of my quality measures at one time. So that has become a routine now for me, is to document falling. And for a geriatric population, which the majority of my patients are, this is a necessary tool that not only am I able to track, but it's made me more aware. I feel like we've decreased the number of falls because we're identifying more fall risk and we're identifying more precautions we can take. And so it definitely was wonderful to score 100% because that's a good feeling. But it was even more wonderful to know that these implementations have improved patient care and safety.
I agree. That's really fantastic to hear, Sherry. Well, thank you so much for sharing your experience with us and for trusting WRS Health as your practice. Is there anything else that you would like to add?
Yeah, sure. One of the things I mentioned was that I was fearful that the cost of these services could be more than what a small practice like I could even afford to do, and so I would just be left behind. But WRS made the whole process cost effective and easy. Through all of your coaches, our monthly meetings and calls, you've helped me bring myself into these requirements pretty easily. And you've also helped me improve the patient care side documentation and tracking of all of that. And it was cost effective. It wasn't crazy expensive like some of these other consultants charging. And so it was just a great package, and I'm really thankful for it. And I'm ongoing with it because each year all of the requirements change, and I don't have time to read through all of that, but you have a super knowledgeable staff that has been so good at educating me, helping me understand why we're doing this and what the benefits are and how we need to do it. And so I feel empowered every year to not only get those scores that I need for those purposes. None of us want to be penalized. I feel empowered to demonstrate good patient care on paper.
Perfect. I'm really happy that you find MIPS services really worth it. And I'm happy that we have brought value to your practice and you are able to focus on patient care. Well, thank you so much, Cherie. We value your feedback, of course, and we really appreciate